Hey everyone, it's Friday and I am so excited that I am here to be able to come to you guys today. I hope you guys had a wonderful Valentine's Day. I know yesterday was the day for lovers. Hopefully you guys all felt loved. And if you didn't, let me just share with you that I love you and I hope that you are doing well. I am sitting here in South Carolina in my desk, or in my office, I should say, and my son's outside playing. He has an Easter or a winter break, and so we've been spending some good quality time together. So I just wanted to come on here really quickly to talk to you guys about a topic that may not necessarily affect you directly right now, but as you age, it certainly will. And it's one of those senses that we depend on daily that we take for granted. So without further ado, I'm your host of Friday 5 Live. I'm Dr. Kalani Tuitt, your board certified family medicine physician that helps busy Caribbean professionals achieve optimal health on the go. Through my concierge medical services and virtual platform, you can live a life of abundant health by having access to premium healthcare on demand. So today's topic is age-related macular degeneration. How many of you have ever heard of that term? Probably not. Maybe you may have heard it if you went with your parents or your grandparents to the eye doctor's office. And the reason why I wanted to bring this topic up is because February is not only the month of love, it's not only Reggae Month in Jamaica, it's not only American Heart Month where we bring awareness to heart disease, and it's not only Cancer Awareness Month. It is also a month that's celebrated by many ophthalmologists to bring awareness to age-related macular degeneration. And so what is that? Well, the title or the name itself explains what it is. So age, meaning as you get older, usually this is a disorder that affects people over the age of 65. But you can see signs of it starting around the age of 50. Most of us have been affected by it. Macular. The macular is a part of the eye. So if you look through your pupil, if you're looking at a picture, like you're looking at me on this screen, you go through the pupil, the dark part of your eye, which goes to the back of the eye, to the retina, and the retina actually houses an area called the macular. That's where you have central vision. That's what helps you to read books, look at television, drive. It helps you with all your activities of daily living. So if that area is affected and you lose your central vision, that is called age-related macular degeneration. Degeneration means it wears out. It's no longer functioning like it used to. And so this is a disorder that usually happens and affects people over the age of 65. So it's something you should be aware of because more than likely you may be affected by this as you get older. And so there are certain things you can do to kind of help slow down the progression or prevent it from happening. And so and this is actually the leading cause of blindness among adults. So it's not diabetic retinopathy where your diabetes affects your eyes. It's not glaucoma where the pressure builds up behind the eye. And it's definitely not related to cataracts. Age-related macular degeneration is the #1 cause of blindness in older adults. And there are actually two different types of age-related macular degeneration. One is called wet and the other one is called dry. So dry age-related macular degeneration is actually more common. It happens in more so about 85 to 90% of the people that have this disorder. And it's usually a slow and gradual onset. Whereas wet age-related macular degeneration comes on suddenly. It's like 2 weeks ago I was seeing okay, and then all of a sudden everything looks blurry. And so it's less common, occurs in about 10 to 15% of the population. But if you do have this, it rapidly progresses to blindness. And actually dry age-related macular degeneration can convert and turn over to wet age-related macular degeneration. And the biggest difference is that in wet age-related macular degeneration is that it has to do with an abnormality in the blood vessels that are grown in the back of the eye. And so if you have this clumping of the blood vessels, they leak, and that can actually cause the blindness in your eyes. Hi, Rennie, and hi, Dwayne. Thanks for joining me today. We're talking about age-related macular degeneration, which is the #1 cause of blindness in older adults. So I just wanted to bring awareness to that because that is what's celebrated during this month of February in the ophthalmology world. So there are some slight differences between the two. For dry age-related macular degeneration, like I said, the onset is quite slow. You may start to see some blurry spots. You may notice that you need brighter lights when you're reading. And you may actually need a magnifying glass. You may have seen your grandparents pull out this big magnifying glass and hold the newspaper up to their face to kind of read. And so it's very, that's usually a sign of it. Yeah, Rennie says his friend's grandmother may have that. And so it's important that they get checked to see. And often they may see spots that are blurry. So let me show you a picture of what that may look like. So this is a regular picture. These kids look cute, right? But in someone who has age-related macular degeneration, the picture may be blurry, so they may not be able to see their faces. They may not be able to see the balls distinctly. So someone who has normal vision will see this, but if they have age-related macular degeneration, this is what it may look like. Things seem blurry, and that's a severe case of it, but they may see little spots. So maybe my eye on the right might look blurry compared to the one on the left, which may look normal. And so in wet age-related macular degeneration, it's a sudden onset. So 2 weeks ago, you were seeing fine, and now all of a sudden, everything looks blurry. And usually it starts in one eye, and it can progress to the other eye. And then when you're looking at straight lines, a way to distinguish between the two is that the lines actually start to get wavy. So let me show you an example of that. So this is called an Amsler grid. So if you've been to the eye doctor, they'll give you this grid which shows lines that are vertical and horizontal. And then when someone with age-related macular degeneration, they'll see that the lines are starting to get wavy and everything looks blurry in the center. And so that's another way to distinguish between the two. So how do you test for this? So essentially, the eye doctor will do a dilated eye exam. And so that's where they put some drops in your eyes, and it makes the pupil go from being very small to really big. And that allows the eye doctor to see everything that's going on in the back of the eye. Remember, the retina sits in the back of the eye. That's where all the blood vessels are. Let's see, I may have another picture of what the back of the eye looks like. So this is what the retina looks like. You have all of this, the blood vessels coming out here. This is the optic disc. And then all your vision occurs here in the macula. So all these little bright spots, these are called drusen, D-R-U-S-E-N. And that's actually the deposits that occur in the macula, which is where you have that central vision. Those deposits occur there, and it actually causes the blindness. So the more of those deposits you have, the increased risk of blindness that can occur. And then in those with wet age-related macular degeneration, as I said before, it has to do with the blood vessels. So it looks a little different. This is a blood vessel that's ruptured, and so they call this a subretinal hemorrhage. And so that bleeding in the back of the eye can actually lead to blindness as well. So these are things that happen as we get older, and it's important that we're aware because there are certain things we can do to prevent this from happening. So a dilated eye exam can help distinguish between the two, as well as a fluorescein angiograph. So this is where the eye doctor will inject a dye to check the blood vessels and see how the circulation is in the back of the eye. And usually that's where they'll see the clumping of the blood vessels or abnormal blood vessels in wet age-related macular degeneration. And so what's the treatment for this? Well, unfortunately for dry age-related macular degeneration, there really isn't much treatment out there. However, for both wet and dry, there are some vitamins and minerals that the doctor may give you to kind of help slow down the progression. And then in wet age-related macular degeneration, they may inject your eyes with certain chemicals to kind of decrease the proliferation or the growth of new blood vessels, or to kind of shrink down those abnormal blood vessels that are occurring in the back of the eye. And so the biggest prevention that you can do to reduce your risk of developing age-related macular degeneration is to not smoke. Smoking doesn't only cause lung cancer, it doesn't only affect your colon, doesn't only affect your skin and make you look older. It can also affect the circulation in your body, which includes the blood vessels that go to your eyes. And so if you smoke, you want to quit. If you've quit, you don't want to start again. And if you've never started, you don't want to start now. So with that said, I did want to just bring a little bit of awareness to the disorder called age-related macular degeneration, which is the leading cause of blindness among adults worldwide. And so now that you are aware, we talked about what age-related macular degeneration is, which is the loss of your central vision. So that means it affects your ability to drive, it affects your ability to read, it affects your ability to look at TV or the cell phone, and it also affects all activities of daily living. And usually you'll start to see some blurry spots, or straight lines may look wavy. And so if you notice any of this, you definitely want to go and see a physician, especially an eye doctor who is specialized in doing the special tests to kind of decipher what is causing the change in your vision. We talked about the two types of age-related macular degeneration, which is wet and dry. Dry is more common and is slowly progressive, and wet usually occurs is a little less common, but is more progressive and can lead to blindness quicker. We talked about the different symptoms. Dry, you notice that there are certain blurry spots, and whereas wet, straight lines start to look wavy. And then we talked about the different tests you can do with the dilated eye exam and the fluorescein angiography. And we talked about the treatment, which is mostly multivitamins and minerals that is specially formulated by the eye doctors. So I hope you were able to learn something about this. If you have a family member, a mother, a father, a grandparent, a friend, someone older that you notice they use a magnifying glass, or they may squint their eyes, or they ask you to turn on all the lights in the house so that they can see, they may be suffering from age-related macular degeneration. And it's something that's progressive, it's very hard to treat, but it's important that you are aware, because you, in fact, may be affected later on in life. So thank you for watching. I hope you guys have a wonderful weekend. Again, I am your host, Dr. Kalani Tuitt, your board-certified family medicine physician that helps busy Caribbean professionals achieve optimal health on the go. Through my concierge medical services and virtual platform, you can live a life of abundant health by having access to premium healthcare on demand. And so I want you guys to find out a little bit more about me, and if you want to ask more personal questions, or if you want more information on specific topics, please go and join my private group called Chic Caribbean Club with Dr. Kalani, where I discuss different topics that specifically affect the Caribbean community and in general. So thanks for watching, Rennie. Thanks for joining me, Felicia and Dwayne. And if you're watching this on a replay, definitely put replay on there and share this with someone, because you never know whose life you might be helping. So I hope you guys had a great Valentine's Day. Maybe you're still celebrating through the weekend. If you want to find out what I did, go to my private group, Chic Caribbean Club with Dr. Kalani. Take care. Bye.